availability and functionality of the needed materials, assess the mental status or availability to participate to the procedure. If possible, determine whether screening or complete neurological examination is indicated. This impacts preparation of the client, equipment, and timing. For equipment, wrist of cotton to assess light touch sensation, sterile safety pin for tactile discrimination, sugar, salt, lemon juice, quinine flavors, tuning fork, tongue depressor, paper clip, pen light, and clean gloves. For the implementation, we need to introduce ourselves to the client and verify the client's identity. We need to explain to the client what are we going to do and why it is necessary and how the client can cooperate. So good day, my name is Cez Reyes, and for today I will be your staff nurse. May I know your name and your birthday?
Patterson, June 20, 1999.
Okay, so Mr. Patterson, again I'm Cez and I will be your staff nurse. Then, as ordered by your doctor, I need to do cranial nerve assessment. Have you heard of cranial nerve assessment? Okay, no. So, cranial nerve assessment is we are going to assess your senses. So, your sense of taste, hearing, smell, your hearing, sense of touch, and also we are going to assess your muscle on your face and also in your shoulders. So it gives us detail about your brain function. Before I do this procedure, do you have any question? Okay, so next is perform hand hygiene and observe other appropriate infection control procedure. We need to provide clients privacy. We can close the door and remember, do not lock the door. We can also provide privacy by closing the curtain. The next is we need to inquire if the client has any history of the following. Mr. Patterson, I'm going to ask you some questions and I need you to answer. Do you have presence of pain in head, back, extremities, or your limbs? Okay. Disorientation to time, place, or person. For example, if you forgot the day it is, and then you forgot the name of your mother or your sister, do you forgot? No. Okay. So, how about speech disorder? Loss of consciousness, fainting, trauma, tingling or numbness of your hands. Okay, tremor or tic, paralysis, uncontrolled movement, loss of memory, mood swing, problem with your smell, vision, taste, touch, how about hearing? Okay, that's good. For the cranial nerve 1, we are going to assess the olfactory. So, we ask Mr. Patterson to sit. Mr. Patterson, are you comfortable? Okay, so for this assessment, I'm going to assess your smell. So, I need you to clean your nose and remove any mucus secretion. And there is a trash bin. Mr. Patterson, I need you to close your eyes and then occlude your one nostril. Close your eyes. Okay, so I'm going to put under your nose some scented objects and I want you to identify it.
Orange.
Okay. And I want you to close your eyes again and occlude the other nostril.
Coffee.
Okay. So for the normal findings, the patient or Mr. Patterson can identify the scented object. Next is the Snellen chart, 20 feet away from Mr. Patterson. So Mr. Patterson, I need you to cover your right eye and then try to read the letter
B, E, F, P, O, P, E, C.
Then the other eye.
D, E, F, P, O, P, E, C.
So for the normal findings of the patient is 20/20 vision field. We will check the visual field by confrontation. So, Mr. Patterson, I need you to cover your left eye. And I'm going to cover my right eye. And I need you to nose. Is there any blurred vision? Okay, so I need you to look in my eyes. And then I'm going to put fingers here, and I need you to tell me how many fingers do I have.
1, 2,
Okay. Cover your right eye. Then I'm going to cover my left eye. Look on my nose. Is there any blurred? Okay, so I need you to look to my eyes, and then I'm going to put my fingers, and I want you to tell me again how many fingers do I have.
1, 2.
Okay. For the cranial nerve 3, which is we are going to assess the oculomotor nerve, I'm going to use pen light. Mr. Patterson, I'm going to use this pen light, which is light, and I'm going to assess your pupil. Okay? So for the normal findings, so pupil of Mr. Patterson is equal, round, and reactive to light and accommodation. Next is we are going to assess the cranial nerve 4 and 6, which is the torch clear and abducent. We are going to assess the 6 cardinal position. Mr. Patterson, I need you to look in this pen. I need you to move your eyes, follow this pen, okay? Okay, thank you. Next, we need to assess the cranial nerve 5, which is the trigeminal. We are going to assess the blink reflex, deep sensation, and light sensation. So first, we're going to assess the blink reflex. So Mr. Patterson, I need you to look upward. Look upward. Okay. Then the other. Look upward. So for the light sensation, Mr. Patterson, I need you to close your eyes. And then tell me if you feel something soft. Say the word yes if you feel, okay?
Yes. Yes.
Okay. Here's the deep sensation of the patient. We are going to use the sharp, which is number 2, and number 1 is for blunt. So I need you to close your eyes later, and I have 2 instruments. So this is number 1, which is blunt object. You can feel this. Okay. So this number 2, which is sharp. So tell me the difference of this, Okay. Tell me the difference of this. This is 1, and number 2 is the sharp object. Okay. So I need you to close your eyes again. Thank you. Okay.
1, 2, 2, 2, 1.
Okay, thank you, Mr. Patterson. For the normal finding, Mr. Patterson can identify the difference between dull and sharp. Number 7, which is the facial nerve. So, Mr. Patterson, I need you to smile. Okay, thank you. That's wonderful. Raise your eyebrow. To pout out cheek. Okay, thank you. I need you to close your eyes tightly. Okay. Thank you, Mr. Patterson. The sense of taste of Mr. Patterson on the anterior 2/3 of his tongue. Please protrude your tongue.
Salt.
Okay. Is there ever flavor? that we are going to put on the anterior tongue of the patient, we need to ask the patient to rinse their mouth. To put again another flavor, so I need you to identify the taste.
Sugar.
Mr. Patterson can identify different flavors. Next, we are going to assess the cranial nerve 8, which is the vestibulocochlear, which is, we have three procedures that we are going to do. First is the spoken word. Next is the Weaver test using tuning fork and also the rhymes test. So, Mr. Patterson, I'm going to whisper some word, one word, and I need you to tell it, or I need you to repeat it once that you heard it clearly. Is it okay? Okay, so
Dog. Cat.
okay. So next is we're going to assess for the Weaver test. In tuning fork, we can use it like this. Then Mr. Patterson, I need you to tell me which has a louder sound. Is it right or left?
Both.
Okay, thank you. And then we are going to assess for air conduction and long bone conduction. So, Mr. Patterson, I need you to tell me which has a louder sound. So, is it number 1 or number 2? Is it number 1 or number 2?
One.
Okay, thank you, Mr. Patterson. Normal findings, the client can hear the whisper 1 to 2 feet away, and also client has normal findings of Weaver test, which is there's a balanced sounds that he can hear, and also for the rhymes test, Mr. Patterson told that number 1, which is the air conduction, has a louder sound than the long bone. For the cranial nerve number 9, which is the glossopharyngeal, we are going to assess the sense of taste of the patient on the posterior tongue, and also we are going to assess the movement, if the client can move his tongue. Then, Mr. Patterson, again, I'm going to ask you to tell me the taste. So I need you to protrude your tongue.
Salt.
I need you again to identify the taste. Please protrude your tongue.
Sugar.
Okay, thank you, Mr. Patterson. Next is I'm going to ask you, Mr. Patterson, to protrude your tongue and then move it side to side, up, down. Okay, thank you, Mr. Next is for the cranial nerve 10, which is the vagus nerve. We are going to assess the patient's gag reflex and then the hoarseness. Mr. Patterson, I need you to say ah. So, Mr. Patterson has a positive gag reflex. Then also, we need to assess patient's swallowing. So, Mr. Patterson, I need you to drink water. Thank you. So, for the normal findings, the uvula and the soft palate is bilateral and symmetrical rise. When we say the client to say presence of gag reflex, and there is no problem in swallowing. It's for the cranial nerve number 11, which is the accessory muscle. So first we're going to assess is the trapezius muscle. First, I'm going to apply both of my hands on your shoulder, and then I'm going to apply force, and I need you to resist it and try to shrug your shoulder. Okay? At the count of 3. 1, 2, 3. Okay, thank you. Finding the trapezius of Mr. Patterson has strong muscle. And also, next is, I'm going to assess the sternocleidomastoid of the patient. So, Mr. Patterson, I'm going to place both of my hands on the side of your face, and I'm going to apply force, and I need you to try to resist it, and then look to right and left side. Okay? at the count of 3. 1, 2, 3. Turn your head on the right. Left. Okay. Thank you, Mr. Patterson. Number 12, which is the hypoglossal, we are going to ask Mr. Patterson to protrude his tongue and then move side to side. And then I'm going to apply a tongue depressor, and then I'm going to apply some force, side to side, up, down. Ayun. Thank you, Mr. Patterson. We need to evaluate the client's response in every assessment that we've done, in every cranial nerve assessment. Then document the procedure and other important data on the client's chart.